And on the phone with me right now, always happy to welcome Dr. Joe Congini. He is a sports medicine expert at Akron Children's Hospital. Good morning, Dr. Joe.
Hi, Jean. How you doing this morning?
I'm doing well, thank you. So I
Good.
understand you want to talk to us this morning about sports injuries that happen on the field and how to determine whether somebody's really hurt.
Yeah, I mean, I get asked very frequently, and then especially this time of year, people are watching their favorite college team, pro team, or many people going to high school football games, and they say, what do? Why don't you just go out and drag the person off the field or, do a full exam? Well, you can't be out there for half an hour either. So people say, what do you do in that short period of time where you try to make a decision? What's the best thing for the young athlete? What does the medical team do in evaluating? And so I wanted to give a couple points about the medical team. First of all, the first person out there is the certified athletic trainer. The athletic trainers are the ones that are at the high schools, and I talk about them all the time. They do all the hard work. They know all the athletes. They know their girls and guys. So if they go out on the court or out on the field, they know their people. They go out there first, and they usually jog out there and get an idea. About 30% of the times, Gene, especially when we're out on the field at this time of year, it's just cramping. And very often the medical doctors don't even get all the way up to where the athlete is because the cramps are usually taken care of by the athletic trainers or others on our training staff. About 30% of the time, about a third of the time, it can be a bad contusion or a bruise. They just really got hit hard in an area. They're in a lot of pain and they're down. They're kind of shaking it off and trying to figure out what it is. And fairly quickly our medical training staff figures that out. So that's 60% of the time probably right there. And the other 30+% of the time is where we really have to do some sort of evaluation of what do we do next with these people. So kind of giving a flavoring today of about 30+ years, 33 years that I've been out on the field. We go out there. Most of the time, you'll see the medical doctor like us usually walking out on the field. There's very little that has us run out on the field. My friends kind of joke with me, you look like you're not in a big hurry. Well, the initial eval is usually done by the trainer, so we don't rush out there except for a few things that I'll mention later on, but more urgent things. But most of the time we walk out on the field. I often will talk to the official, the referee, because I asked the referee, did you see or hear anything? They like us to consult them, and by as old as I am, I know a lot of the officials, and they appreciate that because they're also one of their jobs is to keep everybody on the field safe. So I talk to the official a little bit to give the trainer more time, and then I try to tell the official how long we might take. Are we going to be out there a while, or are we going to be out there for a very short period of time? So that's 95% of the time you may see us walk out there. About 3% of the time or 5%, you might see us jog or run out there. And that means there is something urgent going on when the medical doctors are rushing out there a little bit more with a little bit more sense of urgency. And but typically we walk out there. After the trainer tells us what they think is going on, we then start to talk to the athlete. Very early on, I start to just tell everybody, okay, everybody who's sitting around out here, take a deep breath. Take a deep breath. Everybody is hot and speaking real fast, hyperventilating. They're in pain. So I have them breathe, slow down their breathing, tell me what happened. I hear the history again, even if the trainer has gotten the history, and then I start to do an on-the-field evaluation, which is kind of a brief evaluation to just try to see what am I going to have to do next. And so as I do a brief evaluation, I get their breathing slowed down again. Say for a leg injury, a lower extremity injury, we kind of make a decision in 4 different ways we go. Number one, we evaluate it. It looks like it's stable and they're able to bear weight. So we ask them, okay, sit up first. That's the first thing. We give them about 30 seconds where they sit up because they may be a little dizzy under the hot lights and sweating and hyperventilating. And then we'll get them to stand up and they go off on their own power. And we evaluate them further on the sideline. If we think we don't want them to put any pressure on that joint, number two, I'll call 2 teammates over from their sideline often, usually like-sized people. They will lift the player up. I tell them, don't let that leg touch the ground. If it's an ankle, a knee, a hip that I don't want to have bearing weight yet, I haven't done enough of an evaluation, and I'll ask them to either take them to the sideline or sometime even back into the training room. If the meat wagon comes out, they call it the meat wagon, and this brought it up on Sunday when the Browns player got hurt, Jed Wills. They brought out the meat wagon, and they brought him back with the meat wagon. We're often worrying about could it be a fracture, and we don't want it to move at all, so we don't even have somebody carry him off. We put him on. Even in the high schools now, Gene, we have golf carts in a lot of places. Sometimes it's just that the athlete is so big, whatever, but sometimes we're worried it could become an unstable fracture. And so we will call for the meat wagon. And the meat wagon's not a good sign. We typically, if we're having them go off on their own power or with their teammates, that's not as big a deal. But when we're calling for the golf cart, that could be a problem. And the final thing that is definitely a problem is if you see us signaling to the EMS group that is there. I haven't had one of these in about 5 years, and I've been out there 33 years. Until this year, week 1, I had a kid that I had to call for the EMS to come out. It was a bad fracture. I didn't want to move this kid at all, and we had to take him to the emergency room. And so that's the kind of thing, an obvious fracture. Another one that's really rare is a hip dislocation. I've seen maybe 4 or 5 in my whole career. We need to get them off the field. They're in a lot of pain. And so those are the kinds of things. Or a thing called a wipeout injury. I talked last week where they tore all the ligaments and they could have vascular damage. We're going to have to get them to the emergency room quick, so we may as well get EMS out there right away. We have a special signal if we need them there urgently, and that is a neck injury. We don't want anybody to touch or move them. That you might see me running out on the field. No trainer evaluation, no evaluation. If we evaluate the neck, we could make it worse. If somebody has bad loss of consciousness, they're out of it with a concussion, we don't want anybody moving them at all. They could have a neck injury. And also very rarely, twice maybe in a career of 30 years, I've had a heart problem, where I need the AED or the monitor, and I have a special signal for the EMS to come out. But that's a handful of times, 5 or 6 times in my entire career. So in summary, most of the time, 60% plus of the time, 2/3 of the time, we don't even get to the athlete. The trainer's out there looking at a cramp or a bad bruise. If we are doing the evaluation, we try to be timely for the officials, make a fairly rapid assessment, and then get them off the field and then evaluate them further on the sidelines or in the training room. And that's kind of answering the question. At the college level, the same thing. We've worked at Akron U Walsh. At the pro level, at the high school level, that's kind of what goes on with the medical team on the field when we're assessing or evaluating an athlete.
That's excellent information. Thanks for clarifying that for us. Always welcome to be on our show. Dr. Joe Congini, Akron Children's Hospital. He's a sports medicine expert